This is Vibe Science, a top 100 wellness podcast presented by the Radcast Network, breaking wellness barriers and making health truly personal. Here are your hosts, Ryan Alford and Chris Hansen.
Hello, and welcome to Vibe Science. I'm Ryan Alford, your co-host, trying to navigate on this journey of high vibes. That's why I got my good friend, my co-host, Chris Hansen. What's up, Chris?
What's up, Brian? How are you today, dog?
I'm good, man. Anytime I spend with you, you are my ultimate navigator of high vibes. So, I'm always in a good mood when I'm with Chris Hansen.
I appreciate you. I do my best vibing, baby.
Yeah. And I'm pumped to have, not just Doc, my doc, your doc. It should be everybody's doctor. He is a precision-based medicine specialist focusing on health span and longevity. He is Dr. Joel Rousseau. What's up, doctor?
What's up, guys? Hey, Ryan. Hey, Chris. How you guys doing?
Hey, we're good. We should have, we're late here. This should have been like episode 2. But hey, we had to, have all the rest to have before we have the best. I just made that up, like right on the fly.
It's smooth, man. Now I know how you got your wife.
I know, one night only, talked her into it, swooped her in. Oh, what's cooking, doctor? I know, you got it all going on. Flying around, you're, got the ER, you're in the ER, the ER of life and the ER of every day, right? I feel like you're covering all the bases.
Yeah. I'm currently in suburbs of Miami right now. Just relaxing, getting ready to go back to Texas to do my stretch of shifts in the ER.
Yeah. For everybody listening, there's a lot of doctors and supplement things and all this. We're going to be talking a lot about hormones and longevity and health span, all these things. But we have a true practitioner on. Doc is in the ER saving lives every day in Dallas while also bringing to bear these precision-based medicine. And so I think it's a real testament, Joel, to sort of the sides of the world that you're getting to see. Because you're in the ER and you're seeing like emergency medicine, all that. But a lot of that emergency medicine, ironically, if I had to guess, could be due to issues that maybe people did. I know there's always a wreck or something like that, but you do probably a lot of emergency health situations because people didn't have a doctor like you their whole life.
Sure. Yeah. I mean, absolutely. I mean, there's the majority of the stuff that we see in the ER. Yes. I'm in a large trauma center, so I do see quite a bit of trauma, but the bulk of what I see is related to chronic disease, and it's chronic disease when symptoms have manifested and gotten out of control. And, unfortunately, for the most part, not by doing of the patient, but a lot of the stuff that we see and we treat can be prevented.
That's the key here, and that's when you think about it, Chris, like that's the crux of why we do this show. It's like we're trying to empower people to get to their highest level of mind, body, energy, and giving them and bringing them the best of knowledge with people like Dr. Joel so that preventable things can be prevented. Right? I mean, that's what it's all about.
Yeah, that. And I think this understanding that we're realizing, like, look, Joel said it, the disease is manifested. So it's like you've won so long with something else being wrong that now this disease is manifesting in physical symptoms. So I think that's where now, and even Dr. Joel, like you said, he's both our doctors. We're getting back to like, what's the root of the problem? What's causing this? How do we address the root issue? Not just, hey, you're in here now, let me give you some stuff to hold you over, to give you a quick
putting the stents in your heart, but like, okay, how do we avoid getting to that place to begin with?
Right. Like maybe avoid the KFC and you won't need another stent in your heart. Like that's a good starter. And it's funny you say that because I interned for years with a vascular surgeon and he did a lot of stents. And I remember sitting in the ER Not one time did I hear the patient get told, what's your diet? What's your nutrition?
Yeah. It's unfortunate because usually when you get to that state, I mean, you're dealing, the physician, like a highly specialized physician, like a cardiothoracic surgeon, has one job to do. It's to empty out the plaque from your arteries, you know, and that's what he has time to do, you know, and he or she is probably assuming that the responsibility for education to not get there in the first place lies on somebody else and not him or her. But back, you asked, like, how do we get there? And I think that brings up a good point. And what can you do to prevent that? I think the first thing is just realizing that all this stuff does not happen overnight. And most of the stuff is completely silent until it actually becomes an issue. So what are ways to prevent it? Well, first, just being mindful that this stuff exists and it's quite prevalent, and it will happen if you're not proactive to battle against it. So this isn't just something that you can just, I get old and it happens. Well, yeah, it will happen, but it doesn't have to happen. And I think that's one thing I think in medicine that I think we can do a better job of is just eliminate this complacency that having these chronic diseases is a part of the aging process. It doesn't have to be, because if you're aggressive and mindful, getting blood work done regularly, seeing where you're at based off of your genetics and your lifestyle habits, where you may need to adjust, that road to chronic disease can be much, much longer to hit the finish line to have a chronic disease if you're on top of it very early.
Yeah. I mean, I think I've told this story a few times on the show, and I think we've probably even told you, Doc, but like when I was 26, 27, I need to go probably take my old friend to dinner that told me, you know, he was seeing an internal medicine doctor getting his blood taken twice a year. And I was like, that made sense to me. And so even though it wasn't to the precision and the level that we're now doing, it was still better than most people, because most people don't even look at their blood work, you know, but every 2-3 years, maybe. I mean, it's gotten better than maybe it was 15 years ago, but it's still probably not happening as often as it should to see those markers. Right.
Right. And I think, just for illustration purposes, and I know I'm just crazy about talking about cholesterol and cardiovascular disease, just because it hits close to home. I have a family history of it. I have challenges with it, or I have had challenges with it, getting my levels to optimal ranges. So for heart disease, for example, it's the number one killer in the world. And I think that there's several reasons behind that. One is, just we don't have optimal lifestyle to combat it. There are things that we can do to slow down the process. But the other thing, it's plaque buildup in your arteries is silent. You don't feel plaque building up in your arteries at all until when? You either have a heart attack and die, or you have chest pain and a heart attack or angina. All this stuff is completely silent, and it takes years and years and years to progress. Some are more genetically blessed than others, so it happens quicker or less quickly. But for the most part, it's all about everything for heart disease, and specifically looking at things like your LDL cholesterol and ApoB, which tags all of the bad particles that turn into plaque. It's all about how high the level is and the time of exposure throughout your life. So if you're playing the game of, I know something that's directly going to contribute to plaque buildup, the earlier I start to keep it down, and the time of that exposure, limiting that time of exposure, that's the name of the game of prevention. So if you can really shorten the time and the amount that your blood vessel walls see, the insult, then that's how you can prevent this from happening. It's not until you just, I see my levels are low or high, we'll check it next year, I'm not having symptoms. Well, you're not going to have symptoms until it's too late. So I think that's one thing that people have a hard time getting grasp on when it comes to certain chronic disease processes. You don't necessarily have symptoms. Your quality of life is not changing until oftentimes you have an event. And then the event can be irreversible, or your quality of life lowers, and there's no way to get back to the original quality of life. Once you have a heart attack, you lose muscle cells. the heart muscle cells, they die off. So your heart is weaker than it was originally. It's never going to regain that. So that, I mean, you live one life, right? You have one body. So if you have something like that, you're never going to get back to where you were to begin with. So the point is, prevent it from happening in the first place. Preserve as much as you possibly can. And the only way to do that is to get blood work done regularly, to see your own unique biochemistry, to see how your body works in reactions to the environment, types of foods that you can eat. Some people can eat certain types of foods that would normally jack up cholesterol in somebody else. Or maybe it doesn't do it for you. Great. You may have won the genetic lottery, but the only way you're going to know is if you run the tests. So all this speculation that you need to eat this, you need to eat that. Well, that's great in terms from a guideline perspective. And we see studies and reproducible studies that show this and that, but you know, the most reliable and the most accurate information is the precision-based individual approach of looking at what does your stuff show. I don't care what everyone else stuff shows. We use that as a guideline, and then we hone in on what your stuff looks like.
Yeah. Makes note that it's time to check blood work again.
I'm sitting here laughing because it took me 6 months to go get my blood work, even after doc gave me the order to do it. I still was like, nah.
Yeah.
It's not easy, man. It's not just like anything else. Like, for example, I went to 2 days ago, I went to get my teeth cleaned, and I saw the dentist. He's like, you're getting a little bit older. You know, you're seeing, you know, a little bit of gum inflammation. I recommend now that, you know, your teeth look overall really healthy. But I recommend that you get your teeth cleaned every 3 months. I'm like, oh, that's a lot more than the recommendation by most dentists. But yeah, but for you, if you want to prevent or you want to maintain really good oral health, you should do it every 3 months. So like, everyone is individual and unique. You can't go based on what television and what social media is telling you. You have to go based on what is it showing right in front of you. So, you know, some people can get away with getting their teeth cleaned every 6 months, but for me, if I want to make sure that my teeth and my gums are healthy, 3 months.
Doc, you know, health and, you know, a lot of this stuff has become news, you know, like the diet stuff, the supplement stuff, the hormone stuff, and all this, and it becomes difficult to know what to believe in some ways, I think. And as a doctor, I can only imagine there's probably, I don't know if frustration's the right word, but if I was you as a doctor, you know, taught that understands this thing at a precision level that you do, what's your opinion of sort of the news of health and helping people sort of compartmentalize what they should listen to and where that knowledge should come from?
Sure. You know, having doing social media now for a little over a year, it's crazy because I was not exposed to a lot of this stuff. And unfortunately, a lot of what you see on social media is very dangerous and not at fault for the viewer, because a lot of people are extremely charismatic, articulate, even have credentials, but they're not following what the consensus, the broad evidence shows. They have, you know, theories, and they base their views on theories, and they don't follow the full body of evidence. Because I'll give you an example. You can say something, and I'm going to come out with this. I'm going to be talking about seed oils soon. You can say that, for example, that seed oils cause inflammation and oxidation and all of these bad things, and you can find many individual studies that support that seed oils may not be good for you. But when you look at the whole body of evidence, which way does the whole body of evidence show, looking at really good, high quality studies? And when I say studies, I mean randomized control trials and meta-analyses, which are essentially like a summary of a bunch of randomized control trials or observational trials put together. And if they put out this expert review, what does the whole body of evidence show? Not one cherry pick study or a couple. Seed oils really aren't bad for you. In the main context, and everything gets kind of blown out of proportion, and you have to put it into context. And of course, seed oils are ubiquitous in a bunch of crappy processed foods, and we eat a lot of it. But seed oils themselves aren't necessarily the culprit. It's the fact that you have a really crappy diet. So that's just one example, and not to the fault for the viewer, but you listen to someone that has a narrative and a belief, and you follow that because it kind of fits your views and your ideology of the way it makes sense to you. Of course, logically it makes sense, but science doesn't care about feelings. Science cares about what evidence shows. So the way that I handle this situation is I kind of take a combination approach. I look at what guidelines show. I look what the reproducible data shows. I use that as my guide. I don't go far off into left field on some theory that makes sense. And then I look at the individual patient. Do you fit what the guideline shows or not? Because guidelines are guidelines. Okay. It's not meant for the individual. It's meant for a mass of people. So when it comes to that, I think people need to understand that not everything is so black and white. Things are very nuanced, and there are exceptions to so many rules. You can't only look at one side of the story. And oftentimes, if you're seeing really opposing views about things, probably there's a lot of combination in between the two, and it's a lot more nuanced than this is right or this is right. It's the way that you're evaluating and looking at the data. And people that really are experienced and know certain fields very well use certain language that talk about things, and you see the way they talk. They're not extreme. They don't say this is the way that it is. It's much softer language because there's always caveats to this situation. So a lot of this stuff blends together, and the more knowledgeable you are, you understand the nuances. I don't know that really helps, the mainstay viewer looking at things, but I would say this. And I don't know if you guys follow Lane Norton, BioLane. He does a really good job of explaining this. Even if you don't look at the data that it's out there, because it's hard to do. I mean, it took me many years to learn scientific method, to dissect studies, to see, what's a good study, what's a bad study. You could very easily just learn, the process, the hierarchy of how research goes. Like, the best evidence is a meta-analysis. A randomized controlled trial is the holy grail. Then you have other stuff like observational stuff, which is good, but it's not as good as a randomized controlled trials because it accounts for, it can prove causation, as opposed to observation cannot prove causation. It's just an observation. And there are a lot of other confounding events that could skew the data, but it's still good data. But where I'm going with this is, when you watch someone speak on social media and they have very extreme language, then oftentimes they're not an expert in the field, and you have to raise a red flag. Someone that is a lot softer with their language, not using extreme, like this is the way that it is, this is wrong. Like extreme language is a red flag when it comes to science, because there's always exceptions to the rule. So whoever you watch, I would watch to see, do they use those extreme statements? And if they are, I would push back a little bit and maybe start watching somebody else on similar topics to see how their language is.
Yeah. Yeah. You can feel it. I mean, when you're watching, how they're, at least I can. I mean, I've become the cynic of the crowd, but I think, if you're paying attention, you can see the language they're using, how firm they are on something when clearly everything is on a personal level. But I will say this, that's where really what we're trying to differentiate on this show is like, Chris and I are like where we have the magnifying glass. We're bringing people like you, Doc. Like we're on this journey with our audience. Like we're just trying to learn how we optimize our health and well-being. But at the end of the day, it becomes so about the individual person, and I think that's the biggest thing that you kind of just, if you digest it all, it's like you've got, first, let's use like stuff that's been proven in the right studies. But even then it becomes, okay, individually based on your own markers and things like that, what may or may not work for you. And I don't want to say you become your own guinea pig, but like you sort of have to try things, right? I mean, I'm sure you do this with what you do, right? Where, the overriding research, this is safe. we're not going to, hurt anyone, but we want it to have this effect. So there's got to be some, I don't know, trialing of different things and seeing how people react, right? Even for you.
Yeah, I think so. First and foremost, we've talked about this before on one of your prior podcasts. I mean, first thing is first. I mean, if you're going to walk in to my virtual clinic, I only take it when it comes to someone that's going to be doing like a full blown concierge service with me. I only take on clients that have the buy-in that they're going to put in the work and effort to see results, because in reality, the best way to optimize your health is stuff that is free, number one, and it's stuff that requires consistent work and effort. And what I'm talking about is lifestyle optimization. If we look at a gauge from what can move the needle for improving how well you live and how long you live, like call it the green line, close to 100, moving the needle all the way over is lifestyle optimization. So getting good quality sleep, exercising regularly, eating clean, good, proper nutrition, plenty of protein and fiber in your diet, and mindfulness. Having a sense of purpose in life, keeping yourself, cognitively engaged and doing things on a regular basis that stimulate your mind, having, sense of purpose in that regard. Meditation and making sure that you're feeling present. All of these things, keeping your mind sharp and lubricated, staying strong, fueling your body with good food and getting good quality sleep is the foundation for all of this. And the only reason why I preface this first is because I can give you, the stuff out there anecdotally, like there's anecdotal evidence, meaning that like it's through personal experience, and you're seeing a lot of results through individual clients, but there's not these rigorous studies. Randomized control trials have been funded to actually prove that it works. Some of these experimental agents like peptides, we can do some of those things, right? And I don't have a problem prescribing some of those things, just as long as you know that it's anecdotal evidence. We don't have all the literature that supports that it will or won't work in you specifically. But I'm going to have a hard time working with someone who's getting 4 or 5 hours of sleep a night. They're saying that their chief complaint is my energy is low. Well, yeah, your energy's low because you've got crappy sleep, man. I've got all this extra weight. I mean, well, you're sleeping 4 or 5 hours a night of sleep. And we know that sends signals to your brain to eat crappier food, more junk food. Your insulin sensitivity drops. You're not exercising regularly. All the things that you need to do to move the needle in the right direction. I mean, I can give you the latest scientific potion that's out there, but it's not really going to move the needle like this other stuff. And the one caveat though, with this is, so we talk about lifestyle optimization, and then moving on from that, I think really the icing on the cake is hormone optimization. So there's only so much that you can do. You can dial everything in from a lifestyle perspective. And then there are other things that, unfortunately, a lot of it is through genetics that, and as we age, our hormones tend to slip. Women obviously much more reliable because they have a hormonal clock that stops menopause, and their estrogen and progesterone drop completely. And we know with them that, it's time to supplement, to refurbish what we've lost. But with men, it's a little bit more of a slippery slope because it tends to drop. Testosterone tends to drop as we age. And So when is the right time to consider, agents to replenish that it highly depends on the individual and based on their symptoms, not necessarily a specific point in time in their life.
Yeah, a lot to unpack there. There's so much. I think there's like two camps when I think about it. What the people that I see and like the stuff that's out there is like, it's either hard extremes towards these really narrow solutions, or it's just wide and broad and not specific enough. It's like, when it needs to be individual. And I don't think anyone, it's interesting, you go straight at like just talking hormones, and I just don't think there's enough education out there about hormone health, like optimal hormone. Like we sort of, in marketing, we sort of talk about the best way to market a product is to market the problem. But what's happening right now is we're just marketing the solution, like testosterone or whatever it is, right? It's like, I feel like there's a really huge opportunity to start educating better around, all hormone optimization.
For sure. And I think the reason why I bring up hormones, and let's just take testosterone, for example. Obviously, testosterone has been labeled as a male hormone when it really shouldn't be, because actually, proportionately, women have way more testosterone than they do estrogen. And women need testosterone optimization just like men do. But the way that you can look at let's just talk about testosterone in general. You can look at it in two camps. When you think about testosterone, you think about, I need testosterone. Why? It's going to improve my libido. It's going to make me stronger and have more energy. That's why a guy wants it, right? And improve muscle mass. But do you guys know all the other benefits of testosterone that I'm super excited about? This is what gets me just super, I'm fascinated by it. And from an organ protection perspective, like it improves your lipids. It makes, your LDL cholesterol lower, your HDL cholesterol better. So the ratio of those get much better. It lowers your blood pressure. It lowers organ fat. It improves your insulin sensitivity. It slows cognitive decline. I mean, it does so many things across so many different platforms. It really, truly is a longevity drug in a sense, especially for someone who has a big drop in it and is deficient. And every man and woman should be optimized when it comes to testosterone. But there's a caveat to this, because I feel like testosterone is just like pushed down everyone's throat in media. And you see a lot of men, younger men, that are asking for it. And for good reason. I mean, it is true that testosterone levels have dropped in young men, significantly lower than what they have been in the past. And my theory behind this is not as much of all of these other things that people talk about, endocrine disrupting chemicals. I think there is some place to that, but really the biggest driver in this is the fact that people are obese. And obesity, and just a quick education on testosterone. So adipose tissue, fat cells, cause a conversion called aromatization of fat cells into estrogen. Okay. So they produce estrogen. So estrogen actually is not bad. Estrogen is actually wonderful for overall health, but it gets a really bad rap because when you get fatter, you get overproduction of estrogen. You don't have a testosterone receptor in the brain. What you have is an estrogen receptor in the brain. So when your body sees that you have excess estrogen, it tells the brain that, and it says, okay, no more testosterone, no more estrogen. So your testosterone levels drop. Okay. But really, estrogen is just kind of a byproduct of this, of you being overweight and fat, which drives down the testosterone. So the main epidemic or pandemic of testosterone reduction is obesity and being sedentary. That is the main thing. That's why we're seeing this trend. And you see it, we're looking at over 70% of our population is overweight. So it makes sense, right?
Yeah.
So the younger population also just have to be careful. My recommendation for a 25-year-old that's got low T, get in the gym, man.
Yeah.
Get in the gym, eat well, get in a caloric deficit if you're overweight. If you're doing all those things and you still have really low testosterone, then we need to talk and we can run some other tests. But for the most part, it's being sedentary. It's not doing proper strength training, compound lifting, and getting proper nutrition and proper sleep. That will help get your testosterone to where you're naturally supposed to be. And giving exogenous, meaning like TRT to a 25-year-old is a big no-no, man. And we see it all the time. And I'm not sure if it's disclosed or not, or just in the fine print, but if you're on testosterone for an extended period of time, it can very well cause infertility that's irreversible. So a 25-year-old reaching for the testosterone lever is probably not the best idea.
Yeah. But I don't know. I know you don't like the hyperbole. I'm a marketing guy, doc, so you just got to bear with me. But like the debunking of testosterone, because I mean, I'm on TRT, through you, and I'll say this: there's like two sides of misconception, I think, and like labeling. There is if you work out at all, and someone were to know you're on TRT, you're juicing, man. That's it. The only reason you're doing it is you're trying to get bigger in the gym. And so that's one camp, or you get labeled in the must have ED, man, must have ED, and it's like, I think you've got those two stereotypes when it's actually, like you just said, I didn't have either one of those. I just went to my doctor at 33, and I forget the exact level. You'll know it better than me. I was like, the low was like, if you're the little chart in the doctor's office was like, I think 300 or something. And my reading was like 301. And he's like, oh, you're good. And I'm like, and I thought about that. I'm like, I'm 301 though. Is that really, or whatever that lowest number was. And I was like, that isn't right. When there was this big wide is like, it could go to 1200 or something, like healthily.
You're on the bottom part of the bell curve.
Yeah, the very bottom.
Not optimized at all, right? He's like, you're at the bottom part. You're good, bro.
But he's good. He's good. And he wasn't.
But you're still within normal limits.
Yeah, exactly. And he wasn't, I don't think he was trying. I think it was a lack of knowledge on his part. I don't think he was trying to keep me in a prison, but it always stuck with me. And then I ended up changing doctors, and then you and I've been working. It's like, but it's crazy. Those two camps combined with like the lack of education of all the other benefits, because even with the being on the low level, I was working out. I had decent muscle definition for a 34-year-old, and I didn't have ED, but I didn't feel like it didn't. I was like, I should feel better than this, I had that underlying. And so,
sure.
But I hate the stereotypes, like, I don't know that I've ever even on any of our shows admitted that I'm on TRT, and not because I don't even know that I've had an opportunity, but I don't really care now. And it's like, but it's a shame.
That's really unfortunate. I mean, from both your perspective and the fact that your physician just kind of dismissed it, but, when you look at testosterone, it's not, yes, it will improve a lot of things. And we talked about from an organ perspective, being on it long enough will help get those numbers in a much better range. But when it comes to like the thing with muscle building so testosterone is not the same thing as anabolic steroids, for one.
Yeah.
And I could inject you with testosterone cypionate or give you HRT cream on a regular basis. If you don't lift a finger and get your butt in the gym, you're not going to increase muscle mass.
Zero.
It does not help. you have to have the drive and effort. The one thing I will say about testosterone, which is great, and I don't consider this a bad thing, is it makes difficult things more pleasurable. Like, it makes you want to get that extra rep. You know, it just, but that's what testosterone does. So the fact that you're on something and using that, oh, you're lazy or you're not cheating. You're trying to get your body to its physiological potential, you know? So,
and like you said, the health benefits, like the undeniable, like longevity benefits, that it's not, because it's always, I think, thrown in that testosterone steroid camp of unhealthy, you know, cheating in a way.
Right.
Because you can't use it if you're in some of these competitions. So I think it also gets that label because of that on some level, that, well,
sure.
Then then a regular guy's using it, he's just cheating in life too, you know, because no, it has all these health benefits. And it's like, it's kind of like if you have a car and it had all these features but they all had were taped down and unusable or something. And it's like, no, we're going to remove all that tape. Like, we're going to make it completely usable, like fully optimized. It's like, why would you not do that if it's healthy?
Right. For sure. Yeah. I mean, testosterone is really, it's a no-brainer. The question really isn't if, it's just when you should be on it, both men and women. Okay. And if like I said, the one caveat being, you know, I have, you know, much younger clients that are asking me for testosterone. I have to just be very clear with them. If you have any desire at all to have children, I cannot recommend that you take testosterone for long-term use. I mean, you can do it for a couple months here and there, and you can preserve your testicular function. But again, why would you want to just do it for a couple months? You should get on it whenever you're ready. There are other agents that we can use to help boost testosterone outside of lifestyle optimization once you've tapped out there. So for your younger audience, if there's any question at all about kids, I'm not going to prescribe it for you.
Yeah, you don't want to, but as a 47-year-old with 4 boys and already snipped, that'd be a good one to debunk, Doc. So like, if you've had been snipped already, TRT still helpful? Absolutely.
Of course.
Absolutely. Yeah.
Of course. So, I mean, it's what it's what testosterone is doing at a cellular level. It's the testicles that are producing it, but how is it acting on your cells, your brain, your heart, your muscle tissue? So you don't need, and are you talking about vasectomy?
Yeah.
Is that what you're talking about?
You know.
Okay.
Oh, the snip. Come on, Doc.
Vasectomy has, of course. I mean, there's so many benefits for testosterone, and having a vasectomy has no effect whatsoever when it comes to whether or not you should or shouldn't take it.
Yep. But I bet you somebody doesn't know that, you know? I bet you.
I never really thought about that, but I guess, I guess that makes sense.
You can see that because I could work my way into it. Like I luckily I have you, so I don't have to. But I can see with the knowledge out there of like, okay, you're no longer producing, you know, something to do with your testicles. So I guess TRT may not be helpful for me or something. I could see somebody working their way into that mentally.
Right. Well, so this brings up another thing when it comes to like certain side effects, even with estrogen, progesterone, testosterone. So let's clear the air here. Testosterone does not cause blood clots. Okay. And it's on the black box warning, but it does not cause blood clots. All of the studies that talk about blood clots are observational studies, not randomized controlled trials like we talked about before. And observational studies cannot prove causation. It's just an observation in time, and they are associating. What testosterone does do is it causes something called erythrocytosis. So it causes your red blood cells to you have more red blood cells. They proliferate more. Okay. It does not cause something called polycythemia, which is kind of intermixed in the medical. And you'd be shocked how many medical doctors say, oh, it's going to cause blood clots, or look, you have polycythemia. No, you don't have polycythemia. Polycythemia is raising all of the cell lines: white blood cell count, red blood cell count, and platelets. Okay. This is nerd stuff, but that stuff matters, because platelet, like, you take aspirin, it helps smoothen the platelets. That stuff can induce blood clots. But testosterone only raises the red blood cells. So, I mean, if just raising your blood cells cause blood clots, people living in high altitude would be dropping like flies, right? Or people that training for triathlons, whatever, they train in high altitude to get the red blood cell count higher. So that is a misnomer. So it doesn't cause blood clots, and it also does not cause prostate cancer. Okay. Now, there are some nuances to that. There is some evidence that it's possible that if you already have pre-existing prostate cancer, it could feed it. So that's why we regularly check the PSA, and if it's elevated, then we do a reflex test, and then we look at your percentage free PSA, and all that stuff we monitor. But prostate cancer is not something that is caused by testosterone. And that's another thing that I feel men, they worry about that, and you shouldn't worry about that. And actually there are some studies that support that high levels of testosterone actually are protective against prostate cancer.
And, again, sometimes we talk and it reminds me, like with the show, like we have the vibe on the left and the science on the right. And these worlds of, alternative health, which can get, sometimes woo-woo, but then the science of modern medicine and having someone as knowledgeable as you, and you need both of these worlds. We have to have someone and guided doctors like yourself with the best of modern medicine, understanding hormones, understanding these levels and reading them with you, combined with like the mindfulness and the, cold plunge therapy and like things like other stuff that's like, it's the blending of these worlds, but it's so complex. Like we need science to guide optimal health. And, listening to you talk, it just like furthers that, because thinking about even the specialists that get it wrong, that aren't just knee deep in the research and the study as you are, because it's your life's work and it's what you're doing with precision-based medicine, and these, and it's not because they're trying to misinform, but I don't know. I think there's a real need for this level of education around
for sure
these kind of things. Chris, anything here? I was going to ask Doc about some other hormones while we're staying on the hormone path, but any thoughts here on the TRT stuff?
A lot that's been said, it's made me think about a lot. I mean, just my view of TRT, when I was younger, right, was all negative. Like I was very against hormones, steroids, right? You maybe had a few kids in school that were doing them for the sports when you're younger, but I had my whole viewpoint was negative, right? I had a stigma in my mind, and it wasn't until I got educated and started working with more physicians and really learning about it that it was reframed as a positive. So I agree. I think even what you said, you've got a lot of people, on social media where, a kid is making a decision off a 90-second clip to go take Trenbolone or something, these anabolics where it's like, dude, talk to a doctor. You know what I mean? And I also say, I think there's a lot of doctors, because there's a lot of money in this, that are just doling out prescriptions, right? You've got guys like that too. So it's like you said, have a balanced approach, look at both sides. I mean, I too am on TRT. You're my doctor. We had a good conversation last Friday about my blood work. I think it's something worth exploring. I think it's funny with the negative stigma around it. And I've had buddies come down to Miami too and work out with me. And they're like, dude, is everyone in Miami like on something? And I'm like, no, not necessarily. I think it's one of those things where your community and similar interests, right? It's who I'm surrounded by. Everyone's health focused, but we are at a time now where guys like you were really educating, where like we're taking the fear out of this and also, approaching it with a balanced caution, right? Everything needs to be, that's why I like you, right? Could you tell me shit that sometimes I don't like to hear, right? Like last week, Dr. Joel tells me I need to cut down on my red meat. I love steak. I'm like, fuck, dude. Like,
yeah, I got that lecture too.
Hey, and I thought of you last night, bro. I ate chicken last night. And I'm like, oh, Dr. Joel would be proud.
I've been eating more seafood. My wife's been getting like salmon and all that. And I don't really even like salmon. I like fish, but I don't necessarily like salmon. And I'm like, all right,
me too, dude. Yeah. So,
see, you guys are going to thank me in the long run. You're going to look at red meat as like a delicacy. Because then you're like, you have a steak every day. You're just like, it's just a steak and it's delicious, right? Don't get me wrong. But
it's for the gains, bro.
I will say that the irony for me, Doc is all about health span and the long term. And things like, to kind of close the book, we'll move on to a couple other things, Doc, but like on TRT, people have viewed it and it's stigmatized as a short-term cheat. When you, as a health span longevity specialist, are sitting here telling us it's actually the opposite, right?
If you're going to be my patient and you're on hormones because you need them, you will be on them for life. It's plain and simple. As long as you're my patient, because it's a win-win. You're going to feel way better. You're going to enjoy life much more. And your blood work and what's going on inside your body is going to maintain health because of it. In addition to all the lifestyle stuff that you're going to be doing, but hormone optimization matters. It really, really does. It moves the needle in so many different positive, or so many different avenues in so many positive directions. So I can't emphasize hormone optimization enough. So we don't just talk about testosterone. We talk about estrogen for men. That can be another topic if you want to. For men, I don't particularly do estrogen supplementation sometimes, but we could talk about that later. So thyroid, and thyroid is huge, and you would be surprised how many people are not who have thyroid deficiency. Okay. They don't have primary hypothyroidism, which is a medical diagnosis of a low TSH, but their thyroid function, the thyroid itself, T3, is not getting inside the cells the way that it should. So you're still having the symptoms. It's not reflected necessarily in the blood work. But when we optimize that, you see enormous changes, more focused, more energy, losing weight. So many things that you wouldn't even think of. It's just related to a hormone.
Yep. I deal with that. We're doing the hormone therapy. or the thyroid, whatever it is, or whatever that pill is I take first thing before anything else.
The MP thyroid.
Yep.
Desiccated thyroid.
Yep. Doc, I do, I know you're kind of, it's not like you're one thing, but it just, since it's out there, I think we'd love to, give our audience the opinion on the peptide stuff. It's all the rage. It's for good or bad or indifferent. People are having and seeing benefits from it. I even read that study that I mentioned before the episode started that like some people are calling it like the fountain of youth because it might have benefits beyond like whether you lose weight or not, but like with heart health and diabetes and those kind of things, because just of how many people ultimately usually end up dying because of heart disease, so if you're cutting that back, you're raising lifespan. But what's your kind of opinion, take? What do we debunk or not debunk with peptides?
Well, I think it's dependent on which peptides we're talking about. So your GLP-1 agonist, your weight loss agonist, there's a ton of really good short-term data on it because they've been studied rigorously and they're out there by all these different pharmaceutical companies. So we have a lot of good short-term data on those, the weight loss drugs. And I think the studies on those are quite promising. I really don't see, we have to look at this individually too. Like people, what is your goal? Who am I to tell you, unless you're someone that has, body dysmorphia and you shouldn't be on something, but we know that you are carrying extra pounds, and for whatever reason, you've tried all the things that you can do and you need to get that weight off, because we know that carrying on extra weight leads to so many bad things. Organ fat itself is an endocrine organ in itself, and it pumps out inflammation. Okay. Which leads to so many different things. So if that's what you need to get yourself over the hump to get to a more ideal body composition, then I don't see anything wrong with it. And these agents work really, really well. And the safety profile on them is pretty good. I do occasionally see some patients that come into the ER that have a hard time initially tolerating certain doses of these medications, but it's usually they just kind of ramp up too quickly, or they don't tolerate one over the other. And what I see is, some GI upset, some vomiting and diarrhea and stuff that usually passes. But other than that, and then what I've emphasized with patients before, just because you're in a caloric deficit and you're using this aid to help you get there, doesn't mean that you shouldn't be just use it as a tool to help, complement, doing all the lifestyle stuff. Make sure that you're still lifting weight and building strength and building muscle mass. Make sure that you are not getting yourself into a vitamin and mineral deficiency. Make sure you're still getting plenty of protein, so that when you are losing weight, you're minimizing the amount of lean body mass, like muscle mass. You don't want to lose too much muscle mass, because that's counterintuitive. I mean, it kind of goes against what you're trying to do. But I'm all for these drugs. At least there's no evidence that says right now that they are harmful. If anything, more indication, because obesity and insulin resistance leads to so many things. It's intermixed with cardiovascular disease. That's why you're seeing cardiovascular benefits with these drugs. So yeah. Now talking about was there a specific other peptide you want to talk about?
No, I think I'd love for you to tell us about some other ones, because we hear about the weight loss peptides. And
okay.
So I'd love
maybe touch on like BPC 157. That's the one I hear about a lot.
Okay. So BPC 157, I don't have a ton of, I've used it once before. I don't have a ton of experience with it. I've prescribed it to a couple of patients, but essentially what it does is it stimulates angiogenesis, which is blood vessel formation, increased blood flow. And the idea is to help, inflammation is not always a bad thing. You need inflammation for repair. It's just, if it's widespread and systemic, that it's a bad thing. But localized inflammation is good, because it helps with injuries. So BPC has been shown to help stimulate recovery for certain types of injuries. Now, all the evidence behind it, just like this and some of the other drugs, because none of these drugs are FDA approved other than the weight loss drugs. So when I say anecdotal evidence, again, I mean, these are like the number N. When I say N, I mean the number of patients. So an N of 1 or 2 or however many patients that are on this, they're telling you subjectively that they feel better on this, or they're under the guidance of a physician, and they are actually looking at specific biomarkers and benchmarks to see if there's improvement. But there's no large clinical data that supports the use of these drugs, which is, I think, fine. And I don't have a problem prescribing them, because my dynamic with patients is a little bit different than a traditional doctor, right? We're like this. So we can go back and forth, and we're checking blood work, and I'm asking you how you're feeling. And if there's any change in the wrong direction, we need to address it. But there's got to be a specific reason why we're taking it in the first place. And we also have to make sure that we are looking at other options first, which I know are tried and true, before we use one of these other drugs. But BPC would be an example of that, can help. I've prescribed it to a couple people, and they swore by it. Lower back injuries, knee injuries, to help with their recovery. Another one being sermorelin, which I think is a promising drug. We need more time and more data to say definitively and to validate that it's There's nothing in terms of the safety, but in terms of, is this something that I can give to the masses? Probably not yet, but I feel comfortable giving it to individual clients as long as we're monitoring it. So for those of you that are unfamiliar with Sermorelin, it is essentially a growth hormone stimulator. It stimulates the pituitary gland to make more growth hormone. So it's an analog. And by doing that, it potentially does a lot of things. It helps to, it can improve skin quality, improve collagen formation and production. It increase energy, improve your sleep. It can help with bone formation, your bone density, improve your muscle mass. So there are a lot of good things. A lot of them are very similar if you do the literature on to testosterone, if you're optimized on testosterone. But
you had me at bone density, doc. Not that kind of bone.
Not that kind
of bone. Okay.
But yeah, I have some patients on Sermorelin. They swear by it. They love it. They're seeing good results. They say, we have done, DEXA scans, which looks at body composition, and there's been some changes. Now, again, I'm just a clinician with one patient or a couple of patients that are using this. It's not standardized. It's not randomized. So all these other confounding things could play a role. It could be some placebo effect, but or there could be other things that are changing the body composition. But if all other variables remain relatively fixed and we're seeing the results, who am I to say that it's not working? And if people are liking it, they're seeing the results, and the safety profile seems relatively clean, and you're having good dialogue, communication with your physician, I'm all for it. So, but yeah, that's another interesting molecule that I'm getting a lot more patients are asking me about that one specifically. And that potentially could be a good agent to give someone that's just, they're not ready for the testosterone yet, where they're at in their life, and they just need an extra push for muscle mass. They're sleep deprived. They don't get good quality sleep. So that's a niche that I see that it could potentially have some benefit.
How would you classify, doc? Like, I know you're not going to like this term because I know you know what it is, but when I hear this, biohacking, right? What we're talking about is biohacking done the right way. And to me, like working with a clinically trained expert in precision-based medicine and trialing things for the right reasons to have positive, outcomes chemically in your body, and seeing, but then doing it through your almost like your own clinical study, because you're watching our blood work, you're doing these things. And if it's not working, great. If it is working, it's safe and all those things. Like, what do we classify this as? Is it just purely Healthspan? But is it, but it is sort of that biohacking sort of like yourself a little bit, isn't it?
Yeah, I get, I don't like to use the term
I know you don't.
biohack.
I know. What's the term then? What do we call it?
I think you're just
optimizing
hormone
yourself.
Optimization.
Yeah,
it's health optimization.
Yeah.
Whether or not that you're actually reversing age, that's a different story. I know there are a lot of genomic clocks out there that claim that they do. I still think the jury is out. I have, talked with vendors about this, and the data does look good, but I still think there is some way to go with that. So you have to take it with a grain of salt. Like, you've got, what's the guy that says don't die, or whatever his name is, saying that he's,
I know you're talking about.
Yeah.
I wouldn't focus on that. I would just, focus on what can I do to make myself as healthy as possible today, and continue to do that consistently on a daily basis. And then we go from there. And you will be, again, in the top 1%, if not top 0.05%, if your hormones are optimized and you're doing the lifestyle stuff. You will be. And then just checking stuff regularly. And then I'll leave it with this. The one thing, it is okay. if you're doing all of these things, and this is where I have more of an integrative approach with my precision base. I'm not a holistic doctor. I'm a medical doctor, allopathically trained, went to medical school. Yes, I do use pharmaceuticals, and I do think there is a place for pharmaceuticals. Okay, I think that you have this dogmatic view of all medicine is bad and we shouldn't trust our medical authority, and then you have the way conventional medicine is, which is sick care right now. But there needs to be more of a connection between the two, in that there needs to be education on how to optimize your health, and you have to take responsibility of your health. You do that in conjunction of medical guidance. And if we don't quite get there in terms of disease prevention, we have excellent tools and agents, pharmaceutical agents out there that can help get you to where you need to go. If you didn't get the best genetic cards when it comes to that specific topic. So I know that's probably for another conversation, but
no,
that's where I view all this stuff. It's not, you're not a failure if you have to take medication. And if anything, pharmaceutical medication is so safe because it's so rigorously studied, standardized, protocolized for purity, potency, efficacy, safety, all this stuff packaged up. I mean, so if it's got a specific job, I mean, by no means should you just take it to replace bad habits and just say, hey, I got to take this and become complacent. But I think that there should be this paradigm shift that, I'm educating myself, I'm taking charge of my health, I'm on top of my health, and I see that I have these deficiencies here, and I have some genetic variables that aren't necessarily favorable. And then it's okay to reach for an agent if with trial and error, and you just didn't quite get to where you want it to be. That's fine. It's totally fine.
100%. That's what we're trying to do here, is educate and, give people the tools and the knowledge to then do it for themselves. Doc, I know we got to roll. Where can everybody keep up with everything you're doing, your social channels, website, all that stuff?
So website is healthspanbydesign.co, and on all social media platforms, Dr. Joel MD.
Doc, we really appreciate it. I'll speak for Chris. We can't recommend you enough to our audience to go learn from him. He may get too busy to fit you in, but you might could get in now. You want optimization, you need to go to him. I'm telling you, he's the best. We really appreciate it, Doc.
Thank you, guys. I appreciate you having me. Thank you for your time.
Chris, any final words?
Appreciate you coming on, Doc. Go follow Joel.
Yes.
Educate yourself.
Thanks, Chris.
Please.
I like the hat today, man. I like the San Diego camo.
Yeah. There it is. Hey, guys, you know where to find us. We're at vibescience.media. We'll have links to all the shows, notes from today, and to Dr. Joel's information and the Healthspan website. Again, we're trying to take you to your highest vibe. We don't know it all. We're just here being your guides, bringing you information, trying to empower you to your highest self. We'll see you next time on Vibe Science. The content discussed on this show is provided for reference and educational purposes. The content is not an attempt to practice medicine or provide specific medical advice. Always consult your personal physician for medical advice and proper diagnosis.
Thanks for listening. This is Vibe Science. To learn more or watch full episodes, visit vibesciencepodcast.com. Here's to discovering your highest vibe